Hello and welcome to the topic Myocarditis in the Cardiology module. By the end of this topic, you should be able to define myocarditis, describe the causes of myocarditis, explain the features of myocarditis, list the investigations done to diagnose myocarditis, discuss the treatment of myocarditis, and finally outline the complications of myocarditis. Let's get started. So, what is myocarditis? Myocarditis describes inflammation of the myocardium. There are a wide range of underlying causes, and it should be particularly considered in young patients who present with chest pain. The causes include viral infections such as Coxsackie B and HIV infection, bacterial infections such as caused by diphtheria, Clostridium, spirochetes such as Lyme disease, protozoal infections such as Chagas disease, toxoplasmosis, autoimmune causes, as well as drugs such as doxorubicin. When we look at the presentation, usually this occurs in young patients with an acute history of chest pain, dyspnea, and arrhythmias. Investigations may include increased inflammatory markers in 99% of the time, raised cardiac markers, and BNP. ECG would show tachycardia, sometimes arrhythmias, with ST-T wave changes including ST elevation and T wave inversions. When it comes to management, the treatment of the underlying cause can be targeted with antibiotics if it's bacterial in origin. Other than that, we would advocate supportive therapy, such as treatment for heart failure or arrhythmias if they are present. Complications-wise, look out for heart failure, arrhythmias, which can possibly lead to sudden death, and dilated cardiomyopathy, which is usually a late complication. So let's summarize. Myocarditis is the inflammation of the heart muscles. Common causes are infections, which can be viral or bacterial. Other causes also include autoimmune drugs and medications. Patients usually present with chest pain, occasionally with arrhythmias and dyspnea. It is important to distinguish this condition from acute coronary syndrome. Here, the inflammatory markers are usually raised together with a rise in cardiac enzymes as well, and ECG may show non-specific ST segment changes. Treatment is targeted at underlying cause of the problem and supportive therapy. We have come to the end of this topic. Thank you.